So here's the deal. Obviously, I want you guys to start off like you normally do. Do you have your gown, both of your gowns and stuff?
I don't mind in there.
Yours in there, okay. So you're not going to be scrubbing in yet. You're going to help her open the case, and then you're going to be opening a lot of this stuff here. You guys can just begin when you're ready, okay? So you guys work together, get this case open like you normally do, work as a team. You know, as soon as you get that case open or the field open, you're going to get your gown on there, and then you're going to help her open up everything that's on here to her field, okay?
Are these for you?
Nope, those, yeah, you can lay those off the side. Those are errands. So, be careful. I'm not sure what just transpired there, but you just went like...
Okay.
Are you okay, or what happened there?
I don't know.
Okay, so just...
You want me to start over?
No, I'm calling things out, and I want you to just realize it, okay? We don't have time to re-wrap this up and start. So, those are things that are movements. Open that up. You need to be aware. If you got to back out like this is what I want you to do. I don't want you to go like...
Okay.
Not sure what transpired. There was something funny in your mind.
You said something to them, and we thought you were calling us out. So, okay.
Gotcha, I'm with you.
We're good.
All right, good. So don't lose it. What are you doing now? Come on. We're opening this field. No.
Okay. You want this on there?
Let's wait for her to get in there first, okay?
You want to put your gown and then start scrubbing all of the rubber.
Are we doing a full scrub? No particles, no dust, no
Yeah, we'll just get in there. We'll go over that. Hopefully you're doing a surgical scrub when you first got here. Get yourself a little wet. No worries. I imagine you know how to do that, right? So get in there, open your gown, get a little wet, and then come in and dry off. Okay.
Good.
So Aaron, before you get in there, I want to have you open up this stuff first, okay? Before you scrub it in. I want to have you open up all that stuff. But wait for her to get in there first.
You give me the all clear. I was just opening.
No, I hear you did.
Am I okay to open it now, right? Or should we wait?
So think about it. If you're not, you're going to be at 10 minutes before you get in there. That can get contaminated. So in theory, let's just wrap it up. I don't want you to say, open it up, and I'm going to be in there in about 10 minutes, because who knows, a rep can go by and like, you know, you never know. So we're going to give this table to you, so that's fine. Sorry.
Thanks, Al.
So you're going to be with her. You're going to be you're going to be her right hand, her wingman, wing lady.
She's good for leaving me. No.
Do not leave. You're the wingman.
She's good for leaving
She's Tom Cruise. Over the Top. No, that's not the wrong movie. So Aaron, kind of clean up as you go, as you do that too. If you see someone. Yes, ma'am. Yes, ma'am. Okay. You're not leaving your wing lady. Got it. You guys are going to be awesome together. You're going to be all day together. You got 7 more cases to do. And you're on call. And there's 5 add-ons. And there's pizza out there. We're screwed. Aaron. Ask her if she wants to spin.
Yeah. Oh, man.
Just go with it. Yep.
That's right.
So stop right there. You're fine.
Oh, I reach behind you?
Yeah. So you're never gonna touch this. You're gonna touch that, right? You're gonna come all the way over here in the front and grab it. You never want to reach back. See how you did that? You want to twist your arm. You never come back here, right? That's dirty. So you need to come to the side so she can grab it, right? Does that make sense?
Yes.
Okay, gotcha.
Yeah.
Don't stop on me. Keep going.
We're not. We're good.
You got this. You got to remember, I'm just pointing things out. And they will do that as preceptors. You can't just like, oh, I screwed up. It's over. I'm done. You just got to keep going with it and learn from it. You got this. Yes, ma'am. So, yeah, so I like to also just communication. If you're coming by, right behind you. So, yeah, get your hands wet. Come on in here and get in there. Yeah. I want you to.
Open our inside scrape.
Yeah. Are you using that in your case? Or what are you using the inside straight for? Is that what you asked?
Yeah. Are we opening anything extra?
Yeah, I just want you to more focus on the mayo.
Okay.
Yeah, don't worry about drapes or anything like that. I like you just to get used to setting up a mayo, and then just to get that's I think where a lot of people fall short on.
So ours requires like a book walter and stuff like that. We don't need that. We're just gonna set up the
And
mayo.
I want that during our trauma experience, I'm going to do a whole trauma case with the book walter, and we're all going to do it, and everyone's going to come in here, and we're going to watch a trauma case. You guys are going to do a trauma case. Okay, so then that book walter will first we'll learn how to put it together, but you guys are going to use it.
Okay. I'm here for comments. What would be the best for that? Just leave it like that?
So when in doubt, just move on. This, you can push your drapes that way. So see, are you talking about this here?
Oh, yeah.
So just go like this. Yeah, just push it down. But you can't, as soon as it goes this way, you can't go like this, right? So just push it down and move on, right? Move on. If you're concerned about an edge, let's say, all right, this is an edge. Do you have a blue towel? Just lay a blue towel over it.
Yeah, that's what I was
Okay,
thinking.
yeah. You're thinking right. Let's just, again, let's just wait for her to get comfortable. Eventually, when she gets comfortable, we'll start opening that stuff. Either you...
Oh, I didn't know if you wanted on maybe the mail for now.
No, let's see. I'm watching, and then eventually I want you to open it up and so she can grab them out of there. There's a bunch of stuff in there. There's sutures in there. There's ties in there. I want that drape opened. Don't open up that laparotomy drape. I want that inside drape brought to the field too, because we're going to use a drape in the carotid. So when we do that, I want you to, once she gets set, get everything open, then you can scrub in, okay? And then you can help drape, and you can also assist with me, and then we'll switch. It's quiet. I can hear a pin drop. Everyone's in their happy place.
It's contagious. I don't know what other place to be in. Gosh.
Can you just kind of go like this, kind of flip it down that way a little bit, just so it's yeah, just kind of flip it out. There you go. That's fine.
Yeah, I didn't even know
I know you're good.
but since it's
I'm sorry. A lot of these bother me.
I struggle with rings now.
Don't worry. Oh, ring stand? Yeah, as long as you cover it. The key is, sorry, back
Maybe
there.
this should be like basic hours, but like if we're ever in a situation where we have to like cough or sneeze or anything, we don't turn our heads, we back away from the field and just cough, right?
Yeah, the rule of thumb is I was always taught never turn and cough because that's your instinct because air is coming out this way.
Right.
So just back up, cough, sneeze, and keep going.
Okay. Gotcha.
It happens.
It's like cold and flu season, and it's all.
And listen, I've done many ortho cases where I had a mask on and the hood system, and it's just snot running down my nose into my mouth, and I just kept going.
And the feeders are good.
What are you gonna do?
Well, that's what I was wondering.
Yeah. You just it just lets you know it's a little salty. And then when I get to a point in the case where the doctor doesn't really need me, maybe I'll say, "Can someone come change out?" And or relieve me real quick, and then I'll break scrub, go to the bathroom, and take care of what I have to. But if you're in the middle of a case and doctor needs you, the patient needs you, you just have you just got to tough it out. And that means snot running into your mouth.
It's like those things you don't think of, like
No,
itch or rubbing your face.
itches are crazy. I know I've had itches in the wrong places at the wrong time. Just like those little funny things you see on Facebook. I just scrubbed in and now my so-and-so itches. Yeah. You will be a part of the club of the scrub techs because you do have to go through a lot.
I can grab it. Let's check the do we need sutures or
Nope. No, suture's not important. I just want instrumentation on your Mayo based on a case you did.
Yes, Brian. Are you going to say something?
No, I'm just watching you.
Okay.
You need to be used to people watching you. Don't feel nervous. Just Brad.
He's your charge nurse, making sure you're not.
Yeah. If they go like this,
Okay.
but if you look at your charge nurse and they go like, who cares? Just go. What happened here? This bothers me.
I don't know.
Oh, whoever put the stringer together didn't put it on there. Shame, shame.
Your other eye is not us.
I know. You yell at them.
Okay.
Looking good? Feeling good? All right, so she's going to start opening some things to your field, okay?
Okay.
I want you to just lay them right onto your Mayo. Do you have an extra blue towel or no? Can you do a small little roll and put it right here?
My lap drape is under my. It's in
whatever you do.
the background.
No, we have a drape for you. It's a thyroid drape. We're going to open it up to your field, okay? We're going to use that. Do it a little small. So Erin's going to start opening stuff, and you guys just do it like you normally do. And now,
You have to grab this one.
and you can tell me what these are. What is this?
Me?
No,
Oh,
I'm sorry. Oh, take it out first. Yeah, so she's fine. Just go in there and grab it, right? It's not going to bite.
Go ahead and grab that.
And just lay it on your Mayo. And that is
A light.
the Doppler.
Yeah, that's the Doppler. I should have known my first.
Go with it. Next up,
Suture.
that is a silk tie.
Silk tie.
Yeah.
Let me open it up first.
Yeah. Lay that in your Mayo.
Silk tie.
You can just go like this and just kind of flip them onto the Mayo there. It's fine.
Open my breath.
Those are your blocks, right? For your clip applier.
No.
-1.
Contaminated. Alright. Circulator, I need more.
That's all right. This is kind of an in-service. That wood on there perfectly. Just imagine that. Ready?
Medical student.
I know. So she's going to grab that because that's going to be awfully hard. I just want you to know what it is. It's an umbilical tape. Erin's the hawk, evidently. She's tearing things around.
I just want to make sure my hands are okay. Is this okay so far, guys?
Yep, you're fine. I'm watching you. Grip. Put that on your Mayo.
Cash the thing.
There you go. Let's go as quickly as we can. And if you're having trouble, she can just grab it. Here's what I want you to do, Erin. So just go on the edge and just have her grab that. It's easier that way. You're doing good. Any instrument, have her grab, because trying to flip it onto a Mayo, you might drop it, right? And you don't. This might be the last one we have that's processed. And that is the Gerald forceps. We'll use that. So, Erin, when you're looking at it, you're looking for any kind of contamination,
Holes.
holes, and if it has a chemical indicator, but this doesn't have one, that's kind of what you're looking for, just so you know.
Package integrity.
I'm going to help you too here. We'll work as a team, so we're speeding up a little bit. Good. Those are heparin syringes. Can you grab those for me? Satinskis. Coolies. Good. Contaminated.
I know.
All right.
Look at, I caught it, but it's so
There you go. Erase it off the video. What are those? Hemoclippa pliers. Pot scissors. Outstanding. Aaron.
I didn't touch it though. That time it was good. Look. So it's,
When in doubt, it's contaminated. I am some doubt.
I'm sorry.
No worries. Wait, hold on 1 minute. He's up on the lip and the.
It hurts scrubbing it.
All right.
This is the don't say anything.
Don't say it. It's not the don't say it. The Dos Equis? That's later. With Mills, then it's for. Yeah, very good. Very good. All right.
The
Job and shunt. Yeah.
How many left do we have?
There are some rubber pieces, so be careful.
I was gonna say, and they're on the
Yeah.
wrong end.
That's me. I did that.
All right.
I'll open it up for you. This is your Ramel. I'm going to open it up. Can I open it to your mayo? For your elevator.
How many needles? Please?
No, Sterile. Definite.
Wheatlanders. They always had it. Suture booties. There's two of them. They wouldn't come like that either way, but that's how I did it. Yep.
Please believe, Brad.
I know. Welcome to my world. No, that's a profundant, but don't worry about it. I've never shown you that. But you know why? Bulldogs, outstanding.
Come on. Look at him.
Come. Oh, God.
Did you see that?
Yeah.
What happened?
Where is the bulldogs right here? Okay, good.
It's not sterile.
I know. Well, we've contaminated like 6 times already. So
Already.
we're just learning thing. I'm watching. That's the loops. Nice.
Why did it come over here, right?
Yeah,
What is this?
yeah. As long as you don't have your back to the field, right? These are Java shunts. So can I have your basin? Check the expiration date. May 4th, 1975. May 4th, 1975. You agree? Right? Java shunts.
I need some fresh ones.
No, no. Don't worry about it. Just leave it in there. So what else is in here? I want the number 7 blade here done. Or knife handle. Set it up. Now set it all up, okay? I'll be back. All right, now I'll help you. So we're just going to call a timeout, and I'm going to help you set this up, okay?
Okay.
And we can work together. So for vascular cases, typically this is fine, right? We're going to have some heparin saline in here. I'm going to put my Java shunts right here for different sizes, okay? So you grab me the vessel loops.
Should you go
We'll get the drape open. Yeah, you can get the drape open, please. Yeah. Oh. Action. So you can actually grab that, open it up like you would do like a banana. So let me see. Yep, just like that. This is going to be brought to your field. Don't worry about it.
My back is
Yeah, watch your back. Okay. So just leave that right there. We'll put this right here. So I'm back to where I'm showing you. Okay. So typically, if you want something white down below here, which we don't have, can you do me a favor, Aaron? In that drawer where all the blue towels are, they're white blue towels. I'm going to show you. I also need some Proline, double arm Proline 6.0 if you want to get that. Aaron, okay. The reason I want to have something white on the bottom, I'll show you why. There you go. I'm just going to want one. So sometimes you can open these white towels to your field. So I would just quickly, on the edge before I did anything, just lay this where it's on the edge. Doesn't matter if it hangs over a little bit, right? Is that a double armed? Good. So then no worries, just wondering. So now I want to have all my local, or my containers for locals ready to go. So I might get lidocaine, which you will. And I might get some heparin. So I like to have those ready to go open in case my nurse comes. So open up your blades. And when those open, we're going to use that 11 blade. I'll show you why. So you can scrub it. Yeah. You're fine. You can touch it. You're sterile. So what I want you to do is open them and put them right into the magnet, right?
Always.
Just better. The reason is because it's going to protect, right? You just throw it on there, it can go through, right? Okay, good. We don't have a 10 blade, so we can get rid of these. Your garbage. We'll throw these away off the field. So, good. We have our vessel loops. We have our Java shunts. We'll get some saline to your field with heparin saline, but I'll go over that in a minute, okay? This is not too much important because you'll have a vascular tray. But I just wanted you to set up. That looks beautiful, the way you set that up, by the way. So we're going to go with the Mayo. So let's just start getting some things off your things, and we'll start organizing this, okay? We have our suture boots. So suture boots, they'll have these little stickies on the bottom, and I like to just get them right on the table here, right? And then we'll load up some mosquitoes, and we'll put those on in a minute, okay? Clip pliers. There's one already ready to go. So clip pliers will come back in 2 seconds. So let me just start organizing this for you. Blocks, do you know what blocks are? Yeah. So I like to try to get it where all these are countable items, right? We're going to have our local. So eventually we're going to get local, right? Our Doppler is going to be probably used at the very end of the case. So I'll probably just put it up here. So we're ready to go. This is going to be used, but first of all, let's just get to a starting point.
Are the tables always the size?
Yeah, you can get larger ones, smaller ones, based on how much room you need. This is a typical size of one, yeah. And now I'm just showing you exposure to you. Have you got a suture, right? It's a countable item. So I like to gather my sharps all in one area. Go off the field. Our Ramel hook we're going to leave there. Right? We have our Dennis Mills forceps we're going to leave there. It doesn't really matter how you want to set it. It's up to you. It's just typically how I would do it. I'll show you how to do some ties in a minute. We have our skin marker. I like to leave it up so where I can see it. The freer is typically going to be used. We have our 2 Wheatlanders. So I start thinking about the case. This is going to come up right here, right? And we're going to be passing that way. So I want to go from this side, things you're going to use first, right? You're going to probably make an incision, right? Makes sense. More likely you're going to do some retraction, right? So I probably have that ready to go, right? This is going to be more towards the end of the cases. The Ramel hook is going to be somewhere in the middle of that case, right? So you're setting it up kind of how the case is going to progress. That's how I was always taught, where there's an order to things, right? You like them? Next one up. And if you think you're done with that process, you're going to itch. I saw you. So anyway, some scissors, some pot scissors on there, right? That's going to be in a process. This is going to be around the middle, kind of with that shunt. So we have a variety of shunts, right? So I like to just make sure they're all clipped. I'm very anal retentive, so I'll probably go in the other direction just so I can see it. So my forceps, right? If I'm going that way, I would probably have them where I can reach them, but they're okay wherever you want to put them. In this case, since I got everything here, I'm just going to put them here. Forceps. We got a forceps here per suture, and it's probably around the end. A common forceps we're probably going to use is in the beginning here. These are called heparin syringes. So we don't have any 10 cc's. Can you give me a 10 cc's? Oh, you already scrubbed it. So anyways, we don't have it. Let's say hypothetically that was a heparin saline. So you would use these as a heparin saline flush. And when I'm done, I'll run and get you 2 more 10 cc syringes. When I give them to you, load these up here, okay? And just have those kind of in the back ready to go somewhere where you can use them. If the doctor says, give me some heparin saline, you're flushing at the field, right? Okay? But in this case, you're using this for local, and I'll get some local to your field in a minute, okay? Have you ever loaded these up before? So you're going to do them now. So you take the white one because that's all we have. The blue one's not here, so we'll put it right here for the time being. So I want to show you real quick. You don't want to grasp it like that and load, because if you accidentally go like that, you could fall out, right? So you want to choke up on it. I'll do one first for you. Go right in there, click on it, and come out, right? And you're loaded up.
That's what that is.
That's it. So you have a hypothetical, this is a vessel, right? Doctor wants to clip off vessel, come over here, right? Right. And then when he gives it back to you, you got to quickly load it up. So go ahead and load one of these up. So we'll leave that up here too, so we have it, right? Have it ready to go. Now just leave the block there too. But make sure you have it loaded up. If I use it during the case, I give it back to you, quickly load it up.
Does the doctor reload that at all during the case? Or
No.
Is it always you? Okay.
It's always you.
I'm just making sure.
Yes, ma'am. So in reality, you'll have 2 sizes, right? You have a medium size and a smaller size, right? Sometimes he wants a small, sometimes he wants a medium. So make sure you give him the right one. Some doctors use ones that are disposable, that they're already preloaded. But some old doctors still use this, right? In this case, we're going to practice just quickly loading them up as we're up there. But wherever these are, starting like this, when you get up there, and if I give it back to you, make sure you put it back exactly where it goes.
Okay.
It helps you with, you doing okay?
Yeah.
All right, Natalie almost cried when I was there.
I'm about to.
So we have some clamps, right? Refundant. We'll probably, in this case, I'm going to have my suture and stuff up here, so I'm not going to have that there. Profunding clamp. Yeah, it's a profundant. We didn't learn it, but I'm just saying it is. Satensky, and then the Cooley clamp, right? These are the bulldogs. Okay, we'll put them there so you know. But these are countable items. Very good. Where the syringes go? Yeah, so go ahead and load that up for me. All right, so good. So next to the Rommel hook, we'll put the umbilical tape. Good, perfect. Have you ever done ties before?
No.
Okay. So I'm going to show you. So in this case, what are ties for? Very good. Okay. So what I want you to do is you have to have some ties ready to go. Tie in a passer and a free tie. I normally just go like this, use this as my area where I can put my ties. So I'll open them up, I'll lay them in here, and I'll close this. And then when it's there, then I can just lay this right here, and the ties will be sticking out. So if I need them, I'll grab them, right? And if I have a tie and a passer, I have that up here. Let's do that now. So this is a 2-0 silk tie. You take it right out. You get rid of these. They look like my hair in the morning. So they're really long, right? Is that how long we want them? Yeah, it's pretty long. So let's cut that in half. Let's actually cut them at this side. Where's this point? This is probably good. So take your stringer off for me, please, and thank you.
How are you going to know how short to cut this experience?
Yeah,
I'm not cutting that long extension.
No, always go. Some people just leave it long. I can do that. I just know what happens is if you're going to be tying off, the doctor's not going to use this for small vessels. I probably would just cut off a little bit, but just so I don't confuse you, we won't cut off anyway. Okay. So no, it's okay. But yeah, experience is good. Then I know that I wouldn't need all this, but you guys probably wouldn't. So I would just wrap this end up in the middle like this, or just get it where it's just hanging out a little bit.
Does that help pull one at a time?
It's just you're going to pull one out at a time, and it's already.
Like laying it in the towel.
Yep, it's just going to control it so it's not everywhere.
Okay.
And so you're like this, right? And just fold that out. Now it's there. So what was this silk tie? So I want you to write 2-0 silk. Just right there, the best you can, or at least 2-0.
On here?
Yep.
Vivian,
Oh, I see where you said the best.
could you?
Yeah.
Thank you. You're the only
So
one.
I would probably, make it sure where you can write big, right? It's hard, I know.
Shut off the thing.
No, in real life, they're used and thrown away. So I would label what it is, and if I had a 0 on one side, I would do it on the opposite and write 0. Sometimes they go back and forth. So this is ready to go here, right? So if you ever need one, you grab it, you give it to the doctors. So then let's do a free tie or a tie and a passer. Have you ever did that before? Your stringer's way too small.
Yeah.
So we have a schnitz. Find a schnitz for me.
Oh, we start with the right.
All right, a tonsil clamp.
And then the lettering.
See how your stringers or your roll's too small and it's falling off the edges?
Yeah.
Yeah, that's a right angle, right? Yeah, trust me, that's what
Chili bread.
I'm gonna find a new career choice.
Really?
What am I looking for?
Is this too much
Yeah.
already?
It's
You're
not too much, but it's just, yeah, it just.
you're fine. I'm here with you.
Understood. I'm not going to be an extern. What am I looking for?
This isn't.
It's also called.
I passed it already.
Do not run out the door on me.
So,
Let me get a right angle, then that's fine. It's fine.
That's another word.
It's fine. I'll take it. I'm gonna use it because I don't think I see a schnitz. So you're good. You're good. You're doing beautiful.
Should have got a mask like you did. These glasses are hurting my face.
I need you to get through this. You're fine. I'm just adding pressure to you. And if your response is the run and high, that's a fight and flight response. It really is. You can do this.
Yeah, they just.
You can't have your mind like, that's all I can ask.
Yeah.
I'm just trying to add a little to it. No one in your in the first day or your externship, no one's going to expect you to do all this. I just want you to see it.
Maybe week 24.
Can we all just take a deep breath?
Yeah.
And God forbid you run out the door. I mean, that's not my purpose here. I don't want you to do that. But you need to go towards that light, that pressure.
That's why we volunteered today, right? I think we're done.
There you go.
I'm always.
But when I hear you say stuff like that, I worry. I don't know. One more new career choice. That means you're that fight or flight. You're trying to run.
Yeah. I'm not gonna run.
And that's what I want to hear. All right, you can just slap me later. Let's go. So anyway, so we have ties on passers.
We're dead.
So what you guys can do is just break, and I'll come look at it. If you guys want to take pictures at it. Oh, you just got scrubbed in?
Yeah.
Oh, then just hang out. Or you guys can come over here. Yeah, because we're just going over a vascular. If you guys are all done, you're comfortable, you went through emotions, you learned all you can, you guys can come over here too, okay? So I'm just going to continue. You guys can listen, and I can give you a quick little synopsis of what we did up here too. But have you all guys, have you all put ties on passers and set up ties? So I just showed how I did it. I'm not sure if you guys know that. Put it in a little towel. You have it ready to go for free ties. Now we're going to do tie and a passer, right? Take it out. Make sure it doesn't fall off the field, right?
I'm getting a headache. Can I take these glasses off?
Yes, ma'am, of course. So typically a schnitz or a tonsil clamp, but we don't have them on our field. But right angles can be used, right? Especially this. Really?
Do you want to use a little bit, or
So
because we were sort of told to like do it almost all the way? Yeah.
yeah, I think if you can just get the tips of it, that's fine. But it has to be where it's going inwards like that. Okay. Now it's just a preference. If you don't do perfect, that's fine. Reason is if it goes around a vessel, they can tie it off or something like that. So I would have some tie, at least one tie and a passer ready. So the doctor needs a tie and a passer, right? Ready to go. He's done with it. Load up another one. If he needs a free tie, pull it out, give it to the doctor. So have those for vascular cases ready to go. Problem is these kind of string up a little bit, but that's fine. So let's load up this 7-knife handle, doctor, with an 11 blade. Good knife handle. You're fine. You're good.
You're not gonna do mine.
I'm going to get it to your field in a minute. I have it here. But this is more of an in-service now, but we will get some heparin and some heparin saline.
Stupid question. What are you specifying as in service?
In-service is educational, and I'm not too much worried about sterile technique at this point. I want you to learn. So we're like, I know you know basics, but for us to do it perfect, it's hard to you guys to slow down and learn because you're looking at it, you're like, what is this? I want you guys, it's all about that vascular carotid case. And that's the whole idea. And I'm just showing you as soon as she loads that up. So lay it on this little blue towel here as I use that as a waypoint. And so it's protective, right? There's your needle driver. So, okay, cool. How are you guys okay? If anyone's hot, they can get out of their scrubs, okay? But
Thank God.
the only,
Can I take some pictures?
of course, yeah. This is like I was just telling Aaron. At this point, I only want 2 people scrubbed in, and hopefully you two take it. When we get to the point when we actually put the drapes on, we got to get serious. Okay,
Take a picture.
take a picture. It'll last longer. Hold on.
We're in service right now. So we're not there.
This is so hot.
I hear you. But don't mess your field up. I want to come up, and you guys are going to everyone. I'm going to look at everything you did up here, and you guys can describe it for me.
Start working on tray like a straight mayo, clip applier,
Yeah, we don't have a football player.
Yeah.
and something else.
So when you're up, So when you're up there, just describe what we're missing. But I want you guys to talk about your case, what you set up. But right now, let's do this first. At the very end, we'll come to your cases, and you guys can describe it.
You get your burn sun already.
Beautiful. You're not breaking, are you?
No,
No,
You're right.
we just took a picture for our
All right, outstanding. So this is the carotid, right? Is everyone here? We're gonna move on. Everyone, is anyone like feeling like they want to run for the door yet?
No.
All right, because I do not want you guys to feel that way.
Say it a lot, but I'm not going.
Okay. Well, I'm concerned because it can be a little much, but this is not something you're going to be thrown into right away. I want you. When I was a student, I was never shown any of this, and I thought, okay, I had to go in there and learn through a lot of being banged up and yelled at, but just being exposed is the idea, right? So we did the karate. Y'all did a case study on it, really quick synopsis of it. You know, if the neck is hyperextended or turned this way, and we're going to be working on that. That's my crude example of a carotid. We're going to work on that, right? So you would have a vascular tray. This is not a vascular tray. We don't have one, right? So anyways, I told everyone, or at least Jasari, that I would put a white towel down because if you look at these sutures, they're blue. And the contrast on blue is terrible. But if I know I open my sutures up and they're over the blue or over the white, I see it so much better. So having some white as contrast, and these are like white towels, or even sometimes when you open up your gown, you get those white, blue, or the white towels in there we don't use. You can use those as some contrast. Don't have to, but that's just a pro tip, right? So up here, you know these instruments. You've seen them. Wheatlander, Javits shunt, pot scissors, the Bulldogs, the Cooley, the Satensky. This one you've never seen before or talked about. That's a profundant clip applier. Never loaded her clip yet. The Gerald forceps, no worries. And the job or the Rommel and the umbilical tape. But when I set this up, I think about how it's going to go over the field, right, and how it's going to be going to the operative site. And I kind of set the order it's going to go. Every case, typically, I kind of set it in some fashion where it's in some form of order. Like if the first thing was a 10 blade, I'll put that where it's closest on that Mayo template. Next thing was what? Medicine bombs or so forth. Kind of go in that order. It helps me out in the beginning to know some structure to how a Mayo is set up. Either way, closest to the operative side is better than on the other side of the Mayo. Did you load it up? Who knows how to load this up?
She was doing it. I think it just bent. I think it just bent on the way out. Here. Try
I was about to
it.
say you were doing it right. Oh, it came out. That's why.
It bent, I think.
Now you know why doctors want disposable ones. Just open a disposable one.
So now that little one would go in the trash bag?
Yeah, it's
or-
just trash. I typically try to put anything in the sharps, a little with a magnet box. So, yeah, so I'd have that ready to go so I can pass the doctor. And if he uses it, you need to quickly load it up. You look, I have 3 more left. We got a couple over here. So that block, you're done with it. You don't throw the block away. It's accountable. Just lay it into your countable area. Right. This is where everything should be in your counts. Sharp are your needle tips, right? Blades. If you're done with hypos, try to gather that at the very end, so it's not like one's over here, one's over there. Everything's there.
We count them as the blocks, right?
Yeah, blocks, not the actual clips. Obviously, you count. We're not going to go through a count, but everything's countable. 1, 2, 2, 4, 6, 8. Who do we appreciate? All these are countable items. Booties, umbilical tape, 2 pieces of the Rommel, that's countable. These vessel loops are countable. So we're going to get some heparin saline into here, right? Why are we getting heparin saline in here and put these vessel loops inside? Why do we do that, you think?
So those slide.
Yeah, so cause feel these is rubbery, right? Can you imagine that going over your vessel? Yeah, that's fine. Oh, you can.
I get the point.
It's fine. So you want it lubricated, right? So put them in there. It's also have heparin saline in there. And heparin's going to help if you put it in there, the blood's not going to accumulate on these and clot. So when you're using these vessel loops, that's another deterrent of the clot building up on there or blood to coagulate on there. You got our Doppler, which will pass off. So anything passable, right, that's going to be passed off. Bovie, suction. We had a Pichon, which probably we would use in this case, but I don't want to use it on our table over there. So do we have an 11 blade? And we probably need, for the first incision, is a 10 blade, but we don't have. Does anyone have a 10 blade I can borrow real quick?
I do. On my
Yeah, but for shits and giggles, we're going to use this 15. So just load up. Do you have a number 3 knife handle? We just had one. I'm talking to, just sorry. Yeah, just go and grab that one. Yeah, that's fine. We're in a timeout mode. So put it with that 11 blade. So we know we have a skin cut, and we know we have the arteriotomy cut, right? That's how I typically would be ready for that. It's protective in case it goes in like that instead of your table, right? And it's kind of organized. If you even want to write skin, and just because sometimes you have a skin in a deeper cut, 2 10s, you don't want to confuse yourself. Just write skin or deep or skin, just so you can define it. But eventually you should know. But in the heat of the battle, you don't want to grab the wrong one and cause infection and go a little bit deeper. So we're going to drape. Any questions on this? Obviously, I'm not going to pour. We would pour 1% lidocaine on our field for local. And obviously, we would have heparin saline in our dish here, or our basin, and then we would fill these up with heparin saline for flushing as we go, right? Heparin syringes or hypos are on there. These are also countable items too because they're small, and don't throw those away because they're metal. They repurpose those. Any questions at all? Am I going too quick?
These are 10 cc syringes. What are those? 10 ml.
What's the equivalent of 10 ml to cc's? Easy math, even Brad can understand.
Same.
It is. It's 1 to 1. Yeah. So if they say, well, how many cc's? It's 10 cc's, right?
This part.
This part, it really doesn't. And this is really not a realistic heparin syringe, but this is a good example of what they would look like, but a little bit smaller. This really doesn't indicate how much you would use. Usually, you want sometimes when you're doing to the carotid, they'll go inside and flush, and that's what they're doing. Why are we flushing out the carotid at the very end? Because we don't want any kind of plaque left up there. Because once you open up the dam, so to speak, that plaque can slowly or quickly go right up and cause a stroke, right? So you want to flush everything out. Yeah, good point though. So we're going to drape. So what would we use? Who's going to drape? Who's going to gown the doctor? Would you like me to get in there and drape with you? Yeah, I'm going to come in here and drape with you. Do you guys have any questions at all so far? No? Okay. We're going to use their drapes over here, okay? So we have a thyroid drape. So, no worries. Do you have 4 blue towels, right? Hi. We're doing all right. So we're going to use that thyroid and then the 4 blue towels. So the first thing we're going to do is a down sheet. Then we're going to square off the carotid. And then we're going to put the thyroid sheet on. It's kind of the same thing principle as we were doing the abdomen. But I'm going to come in first, okay? And I'll work with you.
Yeah.
So Aaron, you gown the doctor for me, okay? I'm coming in. What kind of size glove do you have?
Not 8. 7. I have a 7.
I'm going to try my darndest to get into a 7. You ready?
Do you want to open up an 8?
You got an 8 for me? I'm sorry. Dr. Pepper, are you ready to scrub in? That's fine. 7 outs. Yeah, outstanding. Yeah. I got piano fingers. That's fine. We're going to 7.5. I can do that. So I'm wet. I'm coming in. Obviously, let's see how you gown the doctor. Aaron, you ready?
I need a blue towel. A blue towel.
Don't worry. I used alcohol. I'm dry.
Okay. Good to go.
So what do I need first? Gown or gloves?
Yeah.
All right. Introduce yourself. My name
My
is.
name's Erin.
Nope. You don't what?
I don't know what I'm doing.
But this is an example of what not to say. My name is Brad. I'm a surgical tech student. Good morning, really.
Good morning, doctor.
Doctor might bite, but he's a human. He puts his pants on just like you.
And you're.
Don't say it.
I'm thinking it.
I need you to stop. You need a filter.
I am. And then rights.
Am I right first? Yes, ma'am. So see that little write-in right there?
To you, right?
Yes, ma'am. And you need to make sure you're as far as you can. There you go. Ready?
Perfect. You can fix that once we get your other one.
Yes, ma'am. Open it up.
Trying. There's your grab, right? You gotta grab it and
See
then
that?
what?
All right. You just listen to me
I
a
am.
little bit. All right. See this writing?
Yeah.
Making sure it's in the center.
Oh, in the center.
Okay.
I put it off like your hand.
No worries. Because otherwise, if this is off here, he's going to come in like this. And can you pull this down just a little bit? Some doctors want to have it just all the way exposed like this. And he shouldn't have rings on, but it is what it is. He's a premature doctor, right? Prima donna. Amber, premature baby. That's right. This is my first day. All right, good. Aaron, outstanding. Oh, don't grab my hand. I don't mean. All right, we're gonna go here.
Good enough.
So Aaron is just killing me here. So first thing we're gonna do here is the down sheet.
Would you like me to tie you in the back?
If you can, please.
Sure thing. Scrubbing your hands. What about a clip? Hold on.
What?
Okay.
Go in the back. Grab this. There's nothing to tie onto.
Yeah.
Just leave it then. Just let it hang. Okay.
I did a good job.
So here
Really good at it.
we're gonna go with the down sheet, right? So I showed you guys a little bit before about going over, but be very careful not to come too far up, right? So we want to back off like this. So we want to, the whole goal is to make sure you get the feet covered, right? So you're going to grab one end like this, and we're going to walk up together, right? And just expand it outwards, right? You have a hold of it, okay? And just back out a little bit. And we're going to come down, right? And just drop it. Don't like it. Now, 4 blue towels. Bring me the first one. Now, if you guys want to come over here and watch this drape, and this is important. Now, when you're doing a carotid, it's fine. Just come around here to you. First thing you want to do on a carotid, obviously, this is just my crude example of the carotid. Obviously, the whole idea is to get the first thing up, right, up to the carotid, which is the neck, and then try to get the ear lobe exposed. So you're kind of going wherever the prep is. So they'll prep up to the ear, all the way up to the actual nipple itself, right? So I'm just going to show you here. Start right at the nipple. You're right where you're supposed to be. You're helping the doctor. And then this part, we want to make sure we have the nipple, the earlobe exposed. So the earlobe is going to give the doctor an indication where that actual carotid anatomy is, because it goes in line with it, right? So you have another blue towel or no? Can you grab it off that field?
If you would switch over and do that one instead of walking around.
So as long as you get one that's here first, right? You have a barrier. Got a barrier here, and now I can come over here.
Okay, I was just about to ask that.
So the whole idea is this is giving me a barrier.
Okay.
If I didn't have this, I can't reach over a field.
Okay, gotcha.
It makes sense? I have a barrier here, right? So now I can typically, but if I did on this side first, that's a no-no, right?
Okay.
So create a barrier, make your way around, and obviously that way,
And
right?
that is just like in a sense of not contaminating yourself.
Contaminating myself, thus contaminating the patient. Right, yeah, correct. It's all about barriers. So when you kind of make a mistake like I did, because I'm human and there's an exposure there, just grab another blue towel, right, and try to cover that up, right? So technically I saw that there. I probably should have did another one here and then around the actual earlobes. So that incisive drape or that IO band, can you grab that with a straight Mayo?
No.
Straight Mayo.
Yeah.
Someone play the Jeopardy theme song.
I know it is.
Can you do this?
Is it on the mail?
It might be on the
I got one here.
Okay, we got one.
All right, good. So what I want you to do, Aaron, is cut it about like right here. Okay? Not my finger.
He said cut right here.
I know, just give me a second. And you can lay that back on your table. Now what is this drape? Okay, good. What are some properties to it?
Iodine in it.
Good, and what's that? What's the point of having that? Right, so it fights infection as the case goes on, right? And if you never opened it up before, it has two ports to it. You pull in opposite directions, right? So the objective is, did I cut it too short? No. So as I'm opening it up, I'm pushing down on it, right? I'm pulling up on it. And it's okay to just kind of extend the rest out, right? And you can just drop it or give it to someone. Now, the key is not to get any air bubbles. Take it off a little bit. And this peels off, right? Good. Now we have the thyroid drape. So I can get that. You guys can do that together. So the concept's the same, right? If you did the abdomen drape, you find the center point. You open up, right? We're going to push it towards the anesthesia. And then we're going to push. So hold on. So you're going to come over. Let's say you're the doctor, right? We'll take off the stickies. First you verify. Nurse, can you grab that for me? Thank you. You're so nice. On or off? Would you like stickies on or off? I don't care, whatever you decide. Yeah, so again, we want to find the center point of the incision. In this case, kind of at an angle, right? So get it in there, right? You're fine, you're doing great. You guys are going to work together. So open it up, right? Cuff your hand. Jillian, can you play anesthesia for me, please? Cuff your hand. It's fine. Take your time.
It's stuck to the aisle.
I know. Just be careful. Hold it down. You're fine. It's fine. Don't pull on it.
Oh, I thought you were telling me to.
I didn't say pull. That's fine. I don't want you to pull the thing off. All right, good. Now cuff and go to the feet, right? Why are we cuffing our hands? Because who knows? Maybe there's a machine sitting here, you might hit it. And just drop it, right? I'm good. Take that off. How do we look? We missed our mark, but we're fine. Fine.
Might be tight.
It looks like short play. No, just right. You're good. Fine. All right. So now this is your this is your case, right?
Mm-hmm.
What do you do in this scenario? What's your instincts? It looks like you're ready to. What is this?
I don't know.
You know. So we need to just listen to my voice. You need to get this Mayo up and over the field and set your table up and be comfortable. That's your only objective. Your job is to start passing things off, right? Passing things off, right? Now we're going to be on that side, my dear. So come in this way. It's
Coming in hot. Now, where's the cookies? I would just have to use these.
I'll help you. I'll be like the doctor. Can you listen to the doctor?
Yeah.
So I want to be your doctor, right? So hand me that, right? Where's our Bobby? Let's say our Bobby's that way, right? So our Bobby's on that side. So let's start passing it off, and we'll clamp this down right here. Make sure we have access to it. So just lay the clamp down. Let's get that. We'll get the. Who wants to play anesthesia or the nurse for me? Please.
The Neptune and the.
Don't worry about that right now.
Never mind. Sorry.
Question is what?
Where would be best to have my,
I'll be right there in 1 second. I'm getting this knot. So here's a good thing too. Look at this. If you have a knot or a bird's nest, make sure this is not like this before this case starts. See, can you see how this could be a problem when you're sitting here like this and everyone's watching you? I'm just telling you, all these little things will help you out. Get these knots out. Good.
This should be done.
So nurse, where's your nurse? Are you the nurse? Here. All right. I got enough slack. So you want to make sure you have enough slack, right? Oop. Otherwise, if it goes too far, right, I can't pull it back up, right? So is this enough to reach the field? Yeah, I'm good. So make sure here, these little hoops you can actually go through if you don't know that. These case. Oh, the Doppler. Okay, get another Doppler, please.
New Doppler.
So, good. Got room. We'll leave that there right now. Now we're going to pass the suction off. Same kind of concept. It's going that way. Do we have enough slack to get to the field? Pass it off, right? Pass that end off to the nurse. Run it a little bit, drop a couple bit. Now, do you have enough to get to here, right? Good. All right, cool. All right, we'll put it into here. No, right here, right here. We'll put it into here. Okay. We'll actually have this right here. You want to clamp that down, right? Okay, we're good. Now we have access. Make sure we're not tangled up. The whole idea of this is it doesn't fall. This is not impinged in any fashion, but we have access to the field. We have access to the operative site, right? All cases are that way. What is the best way? As long as you know it's a non-perforated clamp, we clamp down on, right? So we're going to do this case. Now your question was about these. So good. Very good point. So there's going to be 2 points in the case he uses this in the beginning. So just grab this when you get a chance. So the whole idea of this, I'm going to come on that side and just kind of, are you comfortable the way this field is? I know you're not. I know, but let me show you. So is it better to have it like this so you can reach this, and if you need something, you can just grab it? Now, I'm very anal retentive. When I start seeing stuff looking like a hot mess, I get upset a little bit because it needs to be organized chaos, right? This is not going to be used. That's going to be for the end. We got our blade. We need local, right? So we'll get ready for that, right? So what I want you to do is, are you comfortable with passing me stuff this way? So I'm going to ask for pot scissors. I want to see you pass it right? If I ask for the freer, I want to see you pass it right, like a pencil. I ask for a Denson Mills forceps. And if I throw it down like this, don't feel offended. Grab it, put it right back where it is. Be very anal retentive. You have the Satensky, you have the Cooley, you have some Bulldogs, and so forth. So just listen, go with it. Aaron, will need to listen to me because you're my assist. Top Gun. You're my wing lady. Never seen the movie Top Gun?
Top Gun's a great movie.
Oh, I tripped. No one saw that.
Y'all aren't supposed to have your phones in the operating room, y'all.
This is for my own education. I love everyone here. You're doing great, man. I know I'm scaring the hell out of you. Scaring me sometimes. All right, so umbilical tourniquet, please, with the red Robertson catheters. Give that to the assist. Red rubber. Red rum. So here's the deal. I love what you're doing, Aaron. You're taking a step, but you need to listen and don't go in assuming. Okay?
Yep.
Got it. So just, that's why I say keep it simple. I was like you. I think I know the answer. I'm going to go with it.
Okay.
But doctors want just to calm down, especially in vascular. They don't want you to assume or do anything. They'll say, have you spent 8 years in medical school? And you're like, no, I didn't. But just slow down and just listen, right? Especially if you're up in the field as a first assist. Even when I went to school, like, I need to just listen, and it was very comfortable. And eventually you know, and you can anticipate a little bit. But right now, you literally went over here, and that's not where I want to go. So go up to the top. Okay. Pull back a little bit. You're fine. Not a lot. You're fine. And now see this go up a little bit like this and pull the first, just one down to clamp on. Oh, it's okay. Slow down. You're good. Clamp on. Now pull that down over it. Keep going. Keep going. You're fine. Good. Got it. Put the clamp down. Can I get a hemostat, please? Or a mosquito? And this is that Ramel tourniquet, right? We're controlling bleeding. We haven't made a decision yet. Good. And typically you want to push down on that and you clamp, right? All right, so kind of same principle here. Let's get the forceps, that Gerald forceps, please. Good. You see some common themes here, right? Right angle. Give that to the assist. Right behind that, grab one of those blue vessel loops and lay it just like you did the umbilical tape. You're going to come right in the front of that underneath. Very good. And just wait for me. Vessel loop. Slow movements. So only need one. Lay it out. There you go. Bring it around. We're going to do it twice. Nope. Very good. No, you're absolutely right, but I like how you assumed and it was good, but
Yeah.
So I
thought when you meant twice, it was twice of the same.
So that's what I'm just saying. You did it right, but I'd rather have the doctor say do what he wants to do. You just went right in there, right? It's just, even though you were actually right, but can you give us that, please?
Wait, you asking me? What the hell is that, right?
I'm sorry?
Because I gave her his.
No.
No, that's the right one.
What's going on here?
Okay, I'm fine.